There was a story, of course, this week, earlier in the week, another tragic situation where a baby, 28-day-old baby in this case, was left at a bus shelter in Longueuil. When someone noticed and called police, the baby had already stopped breathing, and the tragic part of the story, of course, is that sadly, tragically, the baby died. Even worse, this was the second time in 3 weeks that a baby, a newly born baby, had been left. They were both in Longueuil. The other one was left at a doorstep. Now, to the first case, no one has been arrested or charged with that first one. Police are still looking for any kind of clues. But in the second case, a 33-year-old woman was arrested, received treatment. We don't know exactly what, and has now been released. But it does beg the question, why does this happen and what can be done to prevent it? So I wanted to check. Dr. Samantha Goldwater-Adler is a Montreal clinical psychologist. She specializes in child psychology, and cognitive behavioral therapy. First of all, thank you for being with us. And let me ask the question. My first thought on this, which proves apparently I don't know very much about this, was if you find yourself right in this situation, are you not allowed? Could you simply not go to a hospital, for example, and give the baby up? You pay no penalty to do something like that in this province. Do I understand that correctly?
As far as I'm aware, that is something that is an option, but I don't think it's something that most people are aware of. And especially if you're a woman who's gotten pregnant in a circumstance where you're feeling this strong urge, for these particular women, where they got to the point of abandoning their babies, they've obviously got some significant difficulties going on for them, and I'm not sure if they would know how to navigate that system. I think for most of us, even if we're bleeding, given the waits in ERs, we're reluctant to go. So I'm not sure that people are aware of that really as an option, or they may be afraid that they would get in trouble for doing something like that.
I want to be careful, obviously, in speaking about this because there's more we don't know than we do. But in a case like this, so you're the person, you're panicking perhaps, you don't want people to find out for some reason, you're scared. What else would lead you to do something like this? And is this would you consider this kind of a last resort with respect to what you're going to do with this newly born child?
I think this would be a last. The difficult thing here, Aaron, is that there's something that, for obvious reasons, because there's a lot of stigma and secrecy around this, we don't have a ton of research. And for the two women who have done this in Longueuil this month, we don't know exactly, we haven't found out what their specific motivations are. But what we do know generally that can really increase the risk of this is when women in the course, and it definitely would be a last resource, when there's an unwanted or unplanned pregnancy, when they don't have a lot of social support, where there may be poverty, low maternal age, low maternal education, mental health difficulties or addiction, when there's social stigma. It's basically in circumstances where women are feeling, pregnancy is hard enough. And it's, there's, besides all the hormonal changes, there's huge physical changes that are going on. It's a major transition in life. It's a huge responsibility. And for women who don't feel well equipped to be able to deal with this huge responsibility because of, their circumstances in life or lack of support, lack of prenatal care, or who are in a lot of distress and experiencing mental health difficulties, or for women that have had trauma in their past, who have a history of having been assaulted or having been abused or not having had the greatest parents themselves, this can really, really mess with your head and make it really hard to kind of fall into that role of, okay, I can do this, I can take care of, I can keep a child alive. And they may feel that there's no other, they may find it hard to bond or feel that there's no other option or that the baby would be better off.
As I hear you describe this, and clearly a lot of different decisions have to come into play here, I think to myself, when you find yourself, I imagine as a woman in this situation, if perhaps, you weren't expecting it to happen, that's a long time to have to deal with this eventual outcome, right? I mean, you're pregnant for 9 months, or even in the case if you're pregnant for less than that, but you've been carrying this child around and try to make up your mind what to do because sooner or later, you're going to give birth. I mean, that's got to be a very difficult decision to have to make.
It is a very difficult decision to have to make, and particularly if women don't feel, if they're not getting enough, if they don't feel supported, or they're in a really, dire straits. With this woman, the woman who was arrested and released recently, she was at a homeless shelter. This is somebody who in all likelihood doesn't have a ton of access to prenatal care and social support and safety. For the woman earlier in the month who left the baby, her newborn, on someone's doorstep, she left the baby wrapped in a blanket. and rang the doorbell to somebody who thought that the baby would be better off in this case, and probably tried and just felt completely unsupported and unable. I was worried they were unable to be able to handle this.
I think, again, and I'm obviously speaking from a completely different perspective, I think to myself, there's so many, people who would love to be able to adopt a child. And here's a case of someone giving away a baby that someone else, I'm sure, would have been, thrilled, to become parents too. Sadly, it doesn't work that way. And I'll point out the health ministry, by the way, reacted to the story. And this is a quote: "Abandoning a child is a deeply troubling act that can be a sign of great distress, as you pointed out. In these critical moments, it's essential to remember that asking for help is not only possible, but crucial." How does one ask for help in a situation like this? You mentioned if you don't have a good support system, or maybe you have none, how do you ask for help?
That's a great question, and I think it could be going to visit the social services that are in your area. I'm going to guess that at some of the shelters around, there's probably people that can talk to, can put you in touch with resources, or calling some of the health service numbers, calling 811 or 311 and asking for help and support in there to see what you can do. But again, it's not evident. It's not evident, and for most people, and most of the people that may be listening to this program, they fortunately may not find themselves in this type of situation, right? And so we really have to think of, sort of as a society and the programs that we have in place, can we really be able to better identify women that are at risk, women that don't have a lot of support, women that may have heavy trauma histories, issues with addiction and mental health, particularly women that are in poverty and don't have other supports. And if we can really kind of identify them a bit earlier and be able to offer supports and offer a helping hand to women who may not otherwise know how to access these resources.
Yeah, because, of course, it's not top of mind for them, as you say, right? It's not as if they're looking down a list of, well, who can I call or who should I call?
Exactly.
What happens going forward in a case like this? We mentioned this woman who's been treated, released. What's next here? I mean, do we know? I mean, she's been released. We don't even really know necessarily her relation, if it's even her child, other than she's apparently someone involved in having put this child there.
Yeah, I think that's going to be a matter for the investigators and for the police at this point. I know as much as you do about this, which is not a whole heck of a lot. And if it seems like they took her in and they gave her some support and released her again, it seems like maybe they, evaluate. Yeah, it doesn't seem like in these types, in the two circumstances that are described, it doesn't seem like women that were trying to murder their babies. These were women who may not have felt that they had any other option.
I would ask you, just as we wrap up here, maybe it's unfair, but I think, you probably could answer this question. So what would you say, or what would be the advice, someone who's listening now or knows someone in a similar situation, what do you want them to know?
I want them to know that there is help out there, and there is support out there. It may seem overwhelming or hard to be able to access it now, but going into a hospital, a shelter, calling TELED, or just calling some of the services that are available, and really, exploring and seeing what's out there, because pregnancy, even when we have a lot of support, pregnancy and having a baby is hard. It's extremely difficult, even for those of us that are, the best resourced. And there's no shame in asking for help and getting support when you need it and when you deserve it.
We will leave it at that. Dr. Adler, I thank you so much. Do appreciate your time as always.
Thank you.
Thanks so much.
I'm Luke Wilson. Join me each week for Film Never Lies. Since retiring from the NFL, I've had a lot on my mind, and now I've got my own show. So if you're tired of lazy takes, if you want honest conversations, join us each week. Film Never Lies, available on all TSN platforms and the iHeartRadio app.